I'm Jessica Morris, and I'm going to be doing a final head-to-toe assessment of a patient. Before I came into my room, I have gathered all my supplies, I have checked my orders, and washed my hands. Whenever I go into the room, I'm going to identify my patient using his armband, and I'm going to pretend that there is one on his wrist. Knock, knock.
Good.
Good morning. My name is Jessica. I'm going to be your nurse today. How are you?
Good, how are you?
Good. Can you tell me your first and last name?
I'm Kiefer Kedzior,
And your date of birth?
August 14th, 1997,
Okay, good job. Can you tell me where we are today?
Wachula,
And in what building are we in?
the hospital,
Good job. And what year is it?
2021.
Okay. By doing that, I know my patient is alert and oriented times 3, as he knows where he is, the date, and who he is. Now I'm going to check his vital signs. Mr. Kedzior, are you in any pain right now?
No.
No. I asked pain because pain is the 5th vital sign. I'm going to check his blood pressure, temperature, pulse, and respirations. And then I've already assessed his pain, of which all of those are within normal limits. So now I'm going to start from the top, and I'm going to look at his eyes. Before I assess his eyes, I'm going to have him take his glasses off so I can see the size of his pupils before they have light in them. Mr. Kedzior, can you take your glasses off? Thank you. So I'm going to look at the size, and they are about a 4. So now I'm going to shine the light into his eyes, one eye at a time. Good. Good. And what I'm looking for here is for his pupils to constrict and to not allow the light into his eyes. And his pupils are equal, round, reactive to light. And now I'm going to have you follow this pin in. Yep. And by doing that, his eyes converge, and they also accommodate. And by accommodate, they do a little shaking. Mr. Kedzior, can you tell me what that bowl over there says?
Meow.
Now, by doing that, I'm testing his visual acuity, which is good. And by asking him to do that, I'm testing cranial nerve number 2. As I'm sitting here talking to him, I can see his eyes move, and they're doing a good job. And whenever they move like that, I'm testing cranial nerve 4 and 6. Mr. Kedzior, can you frown for me? Good job. So by him moving his eyebrows down, we are testing cranial nerve number 3. Can you smile at me? Yep. And can you blow some air? I want you to fill your air up with your cheeks up with air, and when I push on him, don't let him go. Good job. So he has good tone in his cheeks, and by doing that, I'm testing cranial nerve number 7. Can you stick your tongue out for me? Yep. And move it all around. Okay. By doing that, I know that his tongue is at midline, and I'm testing cranial nerve number 9. Can you shrug your shoulders for me? Good job. So by bringing his shoulders up to his ear, we are testing cranial nerve number 11. Can you hear that? Close your eyes. Can you hear that?
Mm-hmm.
Yes? What ear is it coming from?
The left.
The left. Okay. Can you hear this?
Yes.
Yes. Okay. Can you tell me which ear it's coming from?
The right. Now it's the left.
Good?
Left.
Okay.
Right.
Okay, that's correct. By doing that, I'm testing cranial nerve number 8. He got a little carried away there and jumped ahead of us. Now I'm going to look at his skin. If we were in the hospital, I would have him take his shirt and his pants off to ensure that I have looked over all of his skin. And when I'm looking at his skin, I'm looking for any lesions, scars, or any open wounds or pressure ulcers or skin tears. From what I see, he doesn't have any lesions or scars. I do see a couple tattoos, so I would note that in my nurse's note. Whenever I picked his hand up, I could tell that he was dry. His temperature was dry, and he was warm, and his skin color is normal for ethnicity. I'm going to do a little pinch, and by doing that, I would do that on his chest, his bare chest, and by doing that, I'm checking his skin turgor, and his skin turgor is good. He's a young man who's nice and hydrated. I'm going to check his pulses while I'm up here at the top. Good. Good. And both sides are +2 for his radial pulses, which is a good thing. Now I'm going to listen to his respiratory system. Before I listen to anything, I'm always going to inspect the area, make sure there's no wounds that I might hit and touch and hurt my patient. All right, Mr. Kedzior, can you take a deep breath for me? Good. Again. Good. Again. Good. Again. Good. Lift your right arm up. Again. Good. Again. Good. I just assessed his anterior side of his chest. I did not hear any adventitious lung sounds, any crackling or wheezing or anything like that. Can you turn to, just kind of turn to, yeah, there you go. Turn a little bit more for me. A little bit more. Well, let's just turn you all the way around. There you go. Okay. So now I'm going to listen to his posterior lungs. Deep breath for me. Again. Again. Good. Go ahead and turn around for me. I just checked his lungs on the anterior or the posterior side, and he has no adventitious lung sounds there either. Now I'm going to listen to his heart. I'm going to listen to a couple different points. His aortic, pulmonic, Erb's point, tricuspid valve, mitral valve. Now I'm going to flip my bell to make sure I don't hear any murmurs. And I'm going to go backwards this time. Mitral valve, tricuspid valve, Erb's point, pulmonic, and aortic. And they all sound good. While I have my stethoscope out, I'm going to listen to his carotid arteries. Good. I'm listening to make sure he doesn't have any bruits present. And I'm only listening to one side at a time to make sure I don't occlude one side so he is unable to have any blood supply to his head. I'm also going to feel them while I'm here, one side at a time. By doing this, I'm feeling, and they are +2 pulses. While I'm thinking of pulses, I'm going to go to his feet. And I'm going to feel here for his pedal pulse and his posterior tib pulse. Okay, now the other side, pedal, and posterior tib. They are both 2+, which is a good thing. While I'm looking at his feet and his legs, I don't see any edema present, which is a good thing. He also doesn't have any varicose veins, which are all things that I would note if he did have them. Now I'm going to assess his abdomen. If we were in a hospital, he would be laying down flat, since that's the best place, or that's the ideal way to assess an abdomen. Mr. Kedzior, are you in any pain in your belly?
No.
No. Do you, before assessing his tummy, I would look at it and make sure that he has no open wounds, just like I did for his chest and back. So he has vowel sounds in all 4 quadrants, which is a good thing. I'll now press on his belly to make sure that it's nice and soft and non-tender. And while I'm pressing, I'm also feeling to see if I can feel any of his organs. Any pain when I press? No? Okay. If he was laying down, I would also feel for bladder distension, and by doing that, I would feel down here. Whenever he's sitting up, it's not an ideal time to do that because your bladder is kind of being pushed upon. Can you turn sideways for me? Turn some more. Yeah, I want your back facing the camera, but not the back of the chair. Yes. Thank you. So while I'm back here, I'm going to see and make sure that his diaphragm moves in the correct, sit up straight, nice and tall. Yep, and take a deep breath. Yep, and by doing that, I'm making sure his diaphragm moves correctly, going in and out, and it does. Now I'm going to test his CVA. I'm going to place a hand here, and then I'm going to hit. Do you have any pain there? No. Any pain?
Nope.
No. Good. Okay, you can go ahead and turn back around for me. Okay, now we're going to do a couple arm movements and such. So I want you to stick your hands straight out in front of you. Yep. And turn them up. Yep. So he has pronation and supination. I want you to push your hands back behind your back. That's hyperextension. Good job. Okay. I want you to look at me. Yep. And now look that way. Yep. And put your chin to your chest. Yep. And put your head backwards so you can look at the ceiling. Good. Good job. Now turn your head, rotate it around in a circle. Yep, that's good. So it's full. We have to do it once. So he has full range of motion of his neck. Okay, go ahead and stand up for me. Okay, I want you to bend forward. When he bends forward, I'm checking his range of motion, and I'm also going to check for any signs of scoliosis. I'm going to feel along every vertebrae. And I want to make sure I don't stand right behind my patient, as that can be inappropriate. Good. No signs of that. Okay, now I want you to lean back. Yep. Good job. Good hyperflexion. Okay, now I want you to stick your foot out in front of you. Yep, flexion. Down. And backwards. Yep, and do the same thing on the other side. Yep, and back. Yep, good job. Okay, and whenever he's doing this, I want to make sure that I stand beside my patient, so if he does become unsteady, I would be there to catch him. Now I want you to walk a couple steps forward for me. Yep, stop, okay, and now walk a couple steps back. Yep, turn around. By doing this, I'm making sure that his gait is steady, which it is, which I would expect for a man of his age to be. Go ahead and sit down for me. Yep. Now I'm going to test his strength. So stick your hands, push up. Yep, push down. Good job. Now I want you to squeeze my hands. Yep, I'm testing his grips, which are nice and strong. Push against my hands. Yep, push down. Yep. It's a lot easier to do that when they're sitting, when their feet aren't touching the ground. Push against my hands. Yep. And pull back against my hands. Yep. So now I'm going to test his feet and their range of motion. Can you invert your feet? Yep. Can you do both of them at the same time? Yep. And now exversion. Yep. Okay, good job. I want you to stand up for me one more time. Yep. And now I want you to close your eyes and stick your arms out. Yep. Okay, go ahead and you can open your eyes and put your hands down now. Okay, go ahead and sit. By doing this, I'm doing the Romberg test on him, and he does not sway. He stands strong like a tree, which is a good thing, so his Romberg test is negative. Now I want you to touch your fingers to your thumb. Yep, on both hands. Yep, that's called opposition, and he also has coordination of his hands. Now I'm going to test his deep tendon reflexes. So it's going to turn this way. The camera can see. Yeah, good job. So I'm going to rest his arm in mine. Yeah. Are you relaxed? Okay. And so then if I had my tool, I would hit my thumb here that's placed on his tendon, and whenever I did that, if he had a good reflex, his hand would just kind of curve in a little bit. I would do that on both sides. And then whenever I did my knees, I would make sure his knees were in a hanging position and his feet weren't touching the floor. And I'd hit here and he would kick out, and that would be a positive reflex. Go ahead and face the camera again for me. Now we're going to test his Achilles tendon. Okay, I want you to just kind of relax. Yep. Okay, and I'm going to squeeze here at his feet, and his toes curled down a little bit. Let's do the other side. Yep, relax your leg on my leg. Yep, good job. Okay, now I'm going to teach my patient, and to provide a good learning environment for my patient so he doesn't feel like I am superior to him and he is inferior to me, I'm going to sit down like I'm having a conversation at eye level with him, and I'm going to speak in a calm tone. Mr. Ketzior, do you do a self-breast exam?
No.
No. So, a lot of men don't know this, but they do have breast tissue, and it is important for them to also assess their breast to ensure that they don't get breast cancer. So, Mr. Ketzior, can I teach you how to do a self-breast exam to ensure that you don't have problems later on down the road?
You got it, dude.
Okay, so before you get in the shower, I would say this while I'm looking at my patient, but I'm also educating you guys. So before he gets in the shower, he would stand in front of a mirror and make sure that his breasts are symmetrical, and he would raise his arms and make sure they were symmetrical. He'd make sure that the nipples were along the same line, and then whenever he got into the shower, he would raise one hand up and use the other hand, the opposite hand, to start in the armpit or the axillary area and feel down using the palms of the pads of his fingers, not the palms of his hand, as the pads are the most sensitive. And he would be feeling for lumps. Once he got to the breast tissue, he would start on the outermost breast tissue in a circular motion, feeling all the way around until he was around the nipple and close to the nipple. If he felt any lumps or dimples or anything that is abnormal, he would contact his primary care provider. Mr. Ketzior, did you understand my teaching?
Yes, ma'am.
If we weren't crunched for time, I would have him repeat the information back to me using, that's a method called teach back method, to ensure he understood what I was teaching him. Mr. Ketzior, are you comfortable right now?
Yes.
Okay, well, thank you for letting me take care of you and be part of your healthcare journey. Here's your call light. My name is Jessica. I'll be your nurse for the rest of the day. Let me know if you need anything, okay?
Thank you.
You're welcome. And on my way out, I would wash my hands.